Okay, we are on record.
Excellent. Well, thank you all for joining this morning. I wanted to take this opportunity, now that we're about a month into the new year, to uh, review and understand our Cigna Health Plan offerings as well as our difference card offerings and how they work together. I know there have been a lot of questions these past couple of weeks on things like how do the copays work on my plans, and how do we use the difference card? And because of that, we thought it'd be a great idea to invite Donna Cudia, who's our benefits broker from Broadreach, along with Emily Coughlin from the difference card, to just walk us through some of those things that are important to know about how the plans work, and more importantly, answer any questions that the team may have. Donna does have the Zoom chat open. The way to use that is if you just take your cursor, and on the bottom of your screen, you'll see a bar that has the items invite, participants, share, chat, record. Please use that chat button if you have any questions, and we'll do our best to answer those questions. Okay. With that said, Donna, the floor is yours.
Okay, perfect. Good morning, everybody. Thank you for joining the meeting. Hopefully, by the end of the meeting, this will be a little bit clearer for you. I know it is a little bit different than what we were used to with United Healthcare Oxford, but I guarantee you it is just as good coverage, if not better. And, this way we'll walk everybody through it. And if you have any questions, please type them in the chat. If we get done early, we can certainly open it up for additional questions as well. And then, of course, you can reach out after the meeting to Ben or Megan or myself directly for any information that you definitely need some help with, maybe on a personal level. So we'll get started here. So we're going to talk about today, we're going to talk about the medical plans. The three medical plans that we have: our high plan, Open Access Plus, our mid plan, EPO, and then the base plan with the HSA. And we're going to talk about how the plans work together with the difference card, because the difference card being that that is the newest piece of benefits coverage that we have for 2020. So let's talk about the medical plans first. So this screen, and hopefully everybody can see it, this screen is a comparison of the three plans, the medical plans. Now, if you notice on the screen, you'll see the high plan Open Access Plus, the mid plan EPO, and then the base plan HSA. These employee responsibilities, so to say, are the same that we had when we were with Oxford United Healthcare. So, for example, on our high plan, if you go down to the middle of the page, our high plan will cover primary care office visits with a $25 copay. Our specialist office visit is going to be a $40 copay. It does have in and out of network benefits, just like on the Oxford plan, United Healthcare. However, anything that applies to the plan deductible, and we're going to get into some screens that show you exactly what applies to a plan deductible, that's going to be covered. That's going to be an employee responsibility for that first $1,000 if you're a single. If there's family coverage, it would be a second person in the family that would be need to meet $1,000. So you have a $1,000 deductible on this high plan for any services such as a hospital stay, maybe if you need diagnostics like an MRI or something like that, outpatient surgery, and so on. When that deductible has been met, a coinsurance level begins. And your responsibility is 10%. So that means Cigna is going to be paying 90% of your claims. You're going to be paying 10% of your coinsurance responsibility until you meet the maximum out-of-pocket of $2,500 as an individual. When you've met that, you're considered covered at 100% for the rest of the calendar year, and your claims will be covered at 100% for the rest of the calendar year, including office visits and prescription drugs. And you can see that a family max out-of-pocket is a second person of $2,500 or a total of $5,000. On our mid-plan EPO, it works the same way. It's just the coinsurance and the deductible is a little bit higher. So you go to see your primary care provider, it's going to be a $25 copay. Specialist is going to be $40 copay. By the way, your preventive care is covered at 100%, so that shouldn't be any copay, no deductible, no copay. And then anything that's going to the plan deductible, again, is going to be subject to that first $2,000 by you as the individual. After that $2,000 has been met, the coinsurance of 20% this time on the EPO plan. It's an 80-20 split. Cigna is going to pay 80% of your claims. You're going to pay 20% of your claims until you meet the max out-of-pocket of $5,500. And then a second person in the family, that would be the $11,000. And again, if you do meet that maximum out-of-pocket, everything is covered at 100%, including your prescription drugs and everything else. So under the high deductible health plan with the HSA, that's our third plan. Again, it is matching what we had with United Healthcare. However, this plan, as those of you know it who are in it, works differently because you don't have copays on this plan. You have a plan deductible in which everything is going to go towards that first $2,000, and that's going to be medical and prescription drugs. When you've met the $2,000, the coinsurance level begins. It's a 90-10 split, so Cigna is going to pay 90%. You're going to pay 10% till you meet the max out-of-pocket of $3,250 if you're an individual. A family is going to be $6,500. The high deductible health plan with the HSA also has out-of-network coverage as well. Okay. So one of the other things we do want to mention that wasn't it's coming in after the fact, after the open enrollment meetings, is that physical therapy, copays, speech therapy, occupational therapy, these physical therapy copays, these therapy copays, these are going to be waived under the high and the mid plans for employees. So rather than paying the specialist office copay, it is going to be a zero cost to employees for the high and the mid plans. Now, Cigna is looking into it, but currently on the high deductible health plan, we are unable at this time to offer a zero copay or a zero cost under a high deductible health plan. And the reason being is because high deductible health plans have to meet certain criteria in order to be eligible for a health savings account, and that's the piece that allows you to put money aside pre-tax into this health savings account. At the time, currently, the only option that will be covered at 100% without any cost to the employee is preventive care, and that these rules are set by the IRS when you're setting up these plans in order for them to be eligible for health savings accounts. Now, Cigna is looking into that. They're checking that with their compliance team, but at this time, there is going to be a cost for physical therapy copays under the high deductible health plan because the makeup of the particular type of plan that is. So I did want to just mention that because that wasn't available when we did our open enrollment meetings.
Hey, Donna, it's Ben. Can you go back to
Yes.
the previous slide?
Yes.
Just one thing I wanted to point out that I've gotten a lot of questions on the team. So let's take the high plan as an example. A lot of employees call me saying, I connected with Cigna, and they're not telling me that my deductible is $1,000. They're not telling me that my family deductible is $1,000. They're saying I have a $5,000 or a $10,000 deductible, which is technically correct. Do you want to give a preview on how the difference card helps with those numbers that you see on the screen there on the deductible side?
Yeah, Ben, we're actually going to have a screen. We're going to have a screen that's going to pop up that's going to show you your responsibility, what the difference card is paying, and what Cigna is going to show as if you call Cigna.
Right.
Because it makes it a little bit easier to understand when you're looking at all three columns. So Ben is right. If you call Cigna, and you're asking about a claim and you're not sure why you have to pay for something, maybe something's going toward the plan deductible, Cigna is going to tell you on the high plan and the mid plan that your deductible is $5,000, and it is. The medical plan does have a $5,000 deductible. However, the difference card is making up the difference between the $1,000 that you owe and the additional $4,000 under the Cigna plan, and it's also picking up coinsurance levels as well. So it's a little hard to see on this screen, but if we get down to I think it's the third screen, it's going to show you the three columns, and it makes a little bit more sense. And that's what I'm going to turn it over to Emily. But just to continue, so you can see your prescription plans. This is the plans with the prescriptions. Just like under our United Healthcare plan, our high plan is a copay plan. So on day one, you're going to pay copays for your prescriptions. Your prescriptions are not going to go towards the plan deductible, with the exception of a specialty medication that might be under the medical plan. There are some certain specialty medications that you will purchase from Accredo, which is a specialty pharmacy, that may go towards the medical plan deductible. It's not very often, but it could happen. But most likely, most specialty meds will be under the pharmacy, but they can go under the medical plan every now and then. But you do have that deductible on the pharmacy, which of $100, just as we did before. That's the employee's responsibility. And then after that $100 has been met for the rest of the calendar year, you're going to pay the copays under plan, the high plan and the mid plan. Under our base plan with the HSA, as you know, in this plan, your prescriptions are going to be covered under the medical plan's deductible first. After you've met the deductible, then you actually do have copays for prescriptions after the plan deductible has been met.
Now, Donna, it's Ben again. I know that these past couple of weeks we had some implementation hurdles where Cigna was at a phase with some of our employees in terms of their prescription drug coverage. My understanding is that those issues have been resolved, but real important for the team to know. What Donna has shared with you is what our coverage is. So if you do have any issues with Cigna, and we shouldn't, honestly, but if you do, just let me know, and we'll certainly take a deep dive into your particular situation.
Absolutely. If you have particular pharmacy issues, reach out to Ben and Megan. They'll give you my contact information. I'll be certainly glad to help. Being that we did move to Cigna for 1/1 from United Healthcare, there's always some bumps in the road. I'd be not honest with you if I told you that there wouldn't be any bumps in the road, but there are. And once we get through a couple things, get everybody settled in, I think everything will work just fine. But I'd be more than willing to help or assist in any way with any pharmacy issues that you might be running into. I have a great contact at Cigna, and we can get things resolved pretty quickly.
Thanks, Donna.
Okay, so this is the screen that I was talking about, Ben. This is a screen. This is an overall of our high plan. And you can see that the green column is going to be the you pay, just like we saw on the prior slides. The middle column is going to be the difference card, where it's picking up, and then the Cigna benefit is in the blue fields. These are the numbers that you will be told when you call Cigna. You're going to be told that you have a $5,000 deductible, and your in-network out-of-pocket limit is $8,150. So that is correct. But the difference card is picking up the difference between what you're paying and what Cigna is going to pay. So I'm going to turn this over to Emily, and she's going to kind of walk us through exactly, how this works, because the next slide is going to show you what is actually applied to plan deductibles. If you do nothing but go to your primary care office visit, or you go to a specialist and you pick up some prescriptions, and you have a really good year and you don't utilize the plan other than those, you may never even need to dip into the plan deductible. The difference card is really going to come into play when you have services that apply to the plan deductible. It's not covering the office copays, it's not covering the $100 deductible under the pharmacy, and it's not covering the pharmacy copays. It is covering mainly only a service that goes towards the plan deductible. So go ahead, Emily. Emily, you there? I think you're on mute. Hello? Is anybody there?
Yeah, we're
Donna.
Okay. Sorry,
we're here.
Sorry, I thought
I'm
I
here.
dropped off altogether. I'm like, oh, great. I'm just going to type to, let's see, Emily, are you on mute?
Donna, this is Teresa. Just while we're waiting for Emily, just one quick clarification for everybody. I want to just make sure everybody's clear, because when you talk about the base plan that has a high deductible, I think the high terminology can be a little bit confusing. So I just want to ensure that everybody understands that the base plan is the one with the health savings account attached to it. And that is not this high plan that you're showing right now. So your previous screens that showed high, mid, and base plans, that's what we're following. So we should really kind of ignore the reference to the high deductible when we talk about the base plan, because I think it causes some confusion.
Understood. Yes, that's true. We'll just call it the base plan with the
HSA. Just a clarification while we're waiting for Emily.
Absolutely.
And Donna, it's Ed Mearsh. Just one other thing too on the physical therapy, and I might have missed it, but and Ben, you could clarify. But when we say that there won't be any co-insurance or copay, any copay, right? That's if they come for physical therapy at a motion location, right? Not if they go to another physical therapy location.
At this time, it's any physical therapy location.
Oh, okay, good.
Yeah, because Cigna doesn't actually have the capability of
parsing it out.
Yeah, right, exactly.
Okay, so gotcha. That's good.
Yeah, it's going to be any physical therapy, speech, or occupational therapy.
Did not know that.
I'm on.
Okay, good morning,
Can
Emily.
you hear me now?
Yes, we can hear you. Okay, so and you can see my screen, right, Emily?
Yes, I've been on the whole time. I don't know what happened with the audio, but
Perfect.
So as you mentioned earlier, Cigna and the difference card are two separate companies. So anytime you reach out to Cigna, they're going to tell you that your benefits reflect that on the far right-hand side. All the difference card really is we're a funding mechanism to help fund the difference in the benefits that you have this year versus the benefits you had last year in order for your benefits to remain the same. So for anything related to copays, as you mentioned, so your primary care, your specialist, prescriptions, the difference card's never going to come into play. Although it is a physical MasterCard, you're actually never going to swipe it. All the difference card is funding are services that apply towards your deductible and coinsurance, and if services apply to your deductible and coinsurance. So Donna, I know you mentioned this earlier, but if you only go to the primary care a few times a year, the specialist a few times a year, you're never going to have to deal with submitting to the difference card to be reimbursed for those deductible and coinsurance pieces. So on the screen here, and I know you went through these benefits earlier, but the you pay column is going to reflect what you're paying as the employee out of pocket. So you do still have that $1,000 in-network deductible as an individual on the high plan, and then an in-network coinsurance limit of $1,500 or a total out-of-pocket limit of $2,500 for the 2020 plan year. And this is going to match your UHG benefits exactly as what they were last year. Everything else, aside from that $2,500 responsibility, the difference card is going to pick up. And how we'll do that is we're going to get either your claims, your EOBs coming directly through a company called Easy Claims, which we'll go over in a little bit, or you would submit those manually to us. And once we receive them, we'll process that claim and issue you a reimbursement once you've met your $1,000 deductible or $1,500 in-network coinsurance limit. So difference card's really funding that difference, or that total amount of $5,650 on the high plan. For any out-of-network services, if you call Cigna, again, they're going to read you that far right-hand column. They're going to tell you that you have a $10,000 deductible. However, the difference card's there to make up the difference. Your total out-of-pocket for out-of-network on the high plan is $3,500. So again, matching what you had previously with UHC.
Okay, so this is the screen that I was talking about. So, to take the questions out of it, when is my deductible what is my deductible going to apply to? So this is a list of some of the services that you will have a planned deductible. And you can see your diagnostic services, laboratory services if you have any blood work done outside of your well visits throughout the year, an inpatient hospital, outpatient surgery, home health care, skilled nursing care, durable medical equipment, and as I said before, specialty medications that might apply to the plan's medical deductible. The medical deductible does not apply to preventive care, the primary office visits, the specialist office visits, because those on day one will be the $25 or the $45 copays, and the pharmacy deductible of $100 prior to the RX copays. So on day one, you will still have your office copays, your $100 pharmacy deductible, and then your pharmacy copays after that. And as we had said, if you do not have any of the services of the above, you'll never even have to worry about that difference card. Just to make that a little bit clearer, because people are concerned about the preventive care and do the copays apply to the deductible first? No, they don't. On day one, you have copays to visit your primary care physician. Okay, so now this is an example of the mid-plan, and this is an EPO plan, so it's in-network only benefits. And again, it's going to work the same way, but again, I'll turn it over to Emily, and she could talk about the amounts again.
Yeah, same exact way as the high plan. So the in-network, the UPay column is going to mimic your United Healthcare benefits. The difference card is going to pay the difference in that out-of-pocket versus what Cigna has as your benefit structure, which is a $5,000 deductible and then up to $3,150 in coinsurance. So it's just important for anyone who's on any of the three plans to understand and realize if you receive a bill from a provider and it says you owe $8,000 for a surgery, that is accurate. In Cigna's eyes, you do. However, the difference card is just a layer on top of your Cigna benefit, and really all its purpose is to bring down that out-of-pocket for you as a member and help reimburse or help pay for those services. And as Donna mentioned, this plan is in-network only, so there are no out-of-network benefits associated with the mid-plan.
Okay. So I've got a question here. I'm going to address it now. It says, so does this mean a difference card does not pull from your HSA? We're going to go into the HSA next, and I'm going to let Emily go into that. But you're correct. The difference card is not pulling from your health savings account. It is covering a portion of the HSA plan, but it's not pulling from your HSA personal account. So we're going to get to the HSA next. But again, this is just another screen, even on the EPO plan, the mid-plan, what services are going to apply to that plan deductible, and basically it's the same as the high plan. All right, so let's talk about the base HSA plan.
Okay, so same idea as the high and the mid. Biggest difference here, right, is that everything applies to your deductible. The high deductible health plan, this plan is a qualified HSA, so it allows you to put money aside pre-tax into your own HSA or your own bank account. When we go through what the difference card pays, every time I say difference card pays, that's actually your employer. So your employer is helping to fund or to pay for services towards your deductible and coinsurance on all three plans. So anytime I say difference card pays, that money is actually coming directly from Motion PT's bank account. So the reason why you wouldn't want to use your HSA funds to fund the difference card portion is because that's your money. So you would use your HSA, if you have one, to help pay for the $2,000 in-network individual deductible that you're responsible for, and then up to the $1,250 in-network coinsurance. So a total out-of-pocket max of $3,250. That's your responsibility as a member. That's where you would want to use your HSA card for. Once you reach the $3,250 sort of threshold, the difference card's picking up everything else. So you don't want to use your own funds when the difference card is going to be picking up anything on top of $3,250. So it's just important to know that the first card or the first step you're going to use is your HSA, your personal funds, and then the next amount the difference card's picking up anything over $2,000, and then we're paying that chunk of coinsurance for any in-network services. This plan also has out-of-network benefits. So as we mentioned with the high plan, the Cigna deductible here is $10,000. Coinsurance is a max of $3,800, so a max of $13,800 out of pocket. The difference card's picking up a large chunk as well. Your out-of-pocket for any out-of-network is going to be a max of $5,250, which is matching what you had previously in 2019.
Correct. Right. Now, this screen is a little bit different than the other two screens because, again, the base plan with the HSA, remember, you have a deductible plan that you have to meet first before Cigna turns on any of their responsibility for your claims. So the deductible, all the services are going to apply to the plan deductible. So that's going to be your, unlike the other two plans, your primary care office visits and your specialist office visits. Again, they're going to apply to the plan's deductible. Prescriptions, diagnostic services, all the other services that we're applying to the plan deductible under the other two plans. The only thing that the high deductible health plan or the HSA plan does not have a patient responsibility is for preventive care. That's always going to be covered at 100%. Okay, so as Emily said, the difference card is a MasterCard that is funded by Motion PT. It's basically designed to help you or reimburse you for your out-of-pocket medical expenses under the Cigna plan because of the higher deductibles and higher maximum out-of-pockets than we had with the United Healthcare. So those services, once you've met your member's responsibility, that difference card is going to apply, and it's going to pick up the rest to cover the costs under the Cigna plan. Again, it is only covering deductible and co-insurance expenses. The difference card will not reimburse for any co-pays or pharmacy co-pays.
So what that means is I don't think you'll be swiping that at the physician's office. Most of the benefit will come through putting an easy claim in to cover those things that Donna had mentioned. Is that correct, Donna?
That's correct. That's correct. So this is a picture of what the difference card looks like. So everybody should have received a difference card. Now it does come in a plain white envelope that does look like junk mail. So if you don't recall receiving this card, please let Ben or Megan know, and we can issue you a replacement card. But please be on the lookout. It does come in a plain white envelope. Make sure you are checking it before you decide to just toss it in the mail. But we can definitely order a new difference card. And remember, everybody that's on the medical plan will receive a difference card. For members over that are on your medical plan that are over the age of 18 will be linked to the parent's card. No, they have their own card. Children under 18 are linked to their parent's card.
So this has been, again, quite a question for Emily, and you answered it last night for me. But for the team, a lot of the employees had mentioned to me that they see an account balance of over $16,000 on their difference card.
Yes.
Now, what exactly does that mean? And wanted to give you an opportunity just to share with the team what that is all about.
Yeah, definitely. It's a question that we do get often. So because the difference card is still technically a MasterCard, we have to apply some sort of maximum or cap to it, credit limit, if you will. So that's what that reflects. What that amount really is, we use it as a placeholder. We refer to it as a ghost amount. It does not mean that you have $16,000 of credit to use and spend, but anytime a claim is submitted for an eligible expense, so for your plan deductible and co-insurance expenses, is drawn down from that $16,000, but that's just the amount we use, and it kind of lines up with the guidelines, the maximum out of pockets that the insurance carriers have in place today. So again, really all it is, it's a placeholder, it's a ghost amount, and it's just where your reimbursements are drawing down from.
Okay, perfect. We do have a question. Would you swipe at your PCP after the out-of-pocket max is reached? No, you would not. So first of all, if you're at your PCP, your primary care, if you're on the high plan or the mid plan, that's only going to be the plan copay. So you're going to pay out of pocket for that under your own form of payment. But again, if you've met that maximum out of pocket, when you meet the maximum out of pocket, when you're at the doctor's office, they may not realize that you're at your max out of pocket. If they do make you pay the copay when you're at the service, because services are being rendered, what you would do is just send in a claim form to Cigna. and they would reimburse you for that $25 or that $40 copay that you just paid because you've met your max out-of-pocket. Because at the doctor's office, they may not realize that. And again, they're supposed to be paid when services are rendered. So you may be charged that, but you're really not paying it because Cigna will reimburse you for that. So I just wanted to be a little bit clear on that. All right, so I'm going to move to the next page. And then we have a note here. So please confirm for all reference on this slide to your ID card is only for your difference card. We have separate Cigna cards for insurance. That is correct. So Emily, I noticed this on the open enrollment meetings as well.
Mm-hmm.
Yes, everybody in the medical plan should have received a white with blue and green Cigna ID card. That is the medical plan ID card. That is, you're going to hand that card to the provider's office, any facility, the pharmacy. That is your actual Cigna ID card with your Cigna, information on there, the RX information, the claims information on the back as well. But Emily, on here we have your Difference MasterCard will be used as your ID card. Can you explain that? Because that
Sure.
confuses me a little bit as well.
Yep, and the reason why it's just in bold letters here is because we just want to remind you guys that you're not using it as a typical credit card. We're not swiping it at the primary care, the specialist. There's nothing it's going to take off of those copay visits because it's only applying to deductible and coinsurance. So your difference card can just be thought of as your ID card with the difference card. So if you were to call in the difference card and say, hi, my name, you could always refer to your card number, and that would help them associate you with your plan in the system. So that's why we just mentioned it here.
Perfect. Thank you for clearing that up. Yes, so when you go to a provider or facility anywhere, you're always going to hand them your white Cigna ID card. This card just kind of sits in your back pocket until you have a claim under the plan deductible. Okay, I'm going to let Emily talk about the next few screens because she knows it better than I.
Yeah, so it's important that everyone has not only a Cigna login. On Cigna, you'll be able to view any claims. You'll see your EOBs, find providers, things like that. But with a difference card, there's a lot that you can do as well. So the first time everyone goes to the difference card website, they'll just be prompted through a registration process. They'll click the purple member login button at the top of the homepage. And then for your username, you're going to use your employee ID, which is going to be your social. And your date of birth will be your password to look up your account, and then it will go through a registration process. So you can change your username and password to something that you'd like instead of using your social. On the website, there's a lot that you can do, but the main reason I tell everyone to sign up for the website is this is the easiest place to ever submit a claim or reimbursement if you need to. So along with emailing your claim, you can also mail your claim. We're located up in White Plains, New York. You can fax your claim into us, or you could use the Difference Card mobile app. And when I use the word claim, what I really am referring to is your explanation of benefits from Cigna. That's the item that we need in order to know what you're being charged from the provider, what you're responsible for in Cigna's eyes, so we know exactly how much to reimburse you as the member. So along with those 4 ways, there's actually a third party that we team up with called Easy Claims. And what Easy Claims does is it links together Cigna and the Difference Card. So as I mentioned earlier, Cigna and the Difference Card are 2 separate companies. We don't talk to one another. If you call Cigna, they're going to tell you that you have those higher deductibles, higher coinsurance amounts. Easy Claims, what it does is it links your Cigna account and your Difference Card account together so that anytime that you do, or if you have a service that applies to a deductible or coinsurance, once an explanation of benefits is generated on your behalf, it's automatically sent on over to the Difference Card, so there's no manual paperwork or manual process that you need to do as a member. Everything's happening behind the scenes. So just to go through an example, you would go in for a surgery, let's say, and that surgery applies to your deductible. A few weeks later, you would get an EOB for that deductible either in the mail or online, and the Difference Card would also receive it if you're successfully signed up for Easy Claims. Once we receive it, we're going to process that claim based on the tables that we went through earlier and reimburse you if you're owed a reimbursement.
Correct. So when you enroll in the mycigna.com member website, that login information is exactly what you're going to use for the Easy Claim. So if you just keep in mind, if you ever have to change a password for MyCigna for that login information, you want to make sure that that new password or new user ID or whatever it is does go over to the Easy Claims as well, because if you do change something and do not let them know, then they're not going to be able to access your information. So you just want to make sure that both are working, side by side with your login information.
Great, that's right.
And Emily, when someone is enrolled in the difference card, do they get, and is there an email that comes out to them that says, welcome, and here's how to log in, and then sign up for the Easy Claims, or do they have to initiate that from the difference card website?
So what we did is we received a list of email addresses, and they went out, I want to say a few weeks back. The email comes from support@easyclaims.com. If you didn't get one, you can either call our customer care line. They'll send another one out. You can contact myself or Donna, and we'll get an email out to you. But a lot of the times they will or they may go to your junk. So if you didn't get one, check your spam, check your junk folder. And if you still did not receive, just let us know, and we'll get an email out to you so that you can sign up.
Perfect.
So I went through an example with Easy Claims earlier, but this is just another kind of step-by-step process of how to file for a manual reimbursement and ideally how the process should work. So when you're going in for any sort of procedure that's going to apply to your deductible, you're going to always present your insurance card to that hospital or facility. They should not be asking you for any money up front because they do need to submit that claim in to the insurance carrier. The insurance carrier is then going to pay the hospital based on their pre-negotiated rates and terms, and they're going to issue out an explanation of benefits, both to you and the provider. That is what the provider is going to bill off of, so they're getting a copy so that they can send you a bill. You're also getting a copy just to show you the breakdown of what your insurance paid and what you're responsible for. A lot of the times, insurance carriers do not mail them out anymore, so you can always log on to the insurance carrier's website to view your EOBs or download them. Once you obtain your EOB, you would then submit it to the difference card along with a reimbursement form, and then the difference card is going to issue you either a check or direct deposit for the reimbursement amount due. Once we give you the funds, those funds are then used to pay the provider's bill. So you've either received the bill already or it's on the way, but again, the bill that you're receiving from the provider is always going to match the EOB. The difference card is just helping to fund or give you the funds back to pay that provider's bill.
Perfect. So, Emily, we do have a question, and this is kind of taking a step back to the Easy Claims. Is that so? When you're signed up with Easy Claims and you're registered, is there a link under the difference card website that how do you communicate with them, or how do you know that you're registered and they're getting everything, or they're seeing all the emails? Is there a contact for Easy Claims at all, or is it
that's a great question, and Easy Claims is another third party that we partner with. So it's not going to show you on the difference card website that you're signed up for Easy Claims because it is another third party. However, if you call in to the difference card customer care center, and what I can do after this is I can run a report for Motion PT that shows who is and is not successfully signed up, just so you guys are aware. But you can always call into the customer care center, and they have the ability to view on a separate portal who is logged, who is successfully signed up for Easy Claims and who is not. If you're not, they'll tell you the next steps on how to sign up.
Okay, so you can't actually call Easy Claims, but you can call the customer care team, and they can see on their side that you're successfully registered. Okay.
That's good.
So another question: if you have dependents that are over 18, yes, they have to sign up their own individual account at mycigna.com as well, because they are over the age of 18. So you may want to have them, register with Cigna as an individual themselves. And then also register with Easy Claims as well. because anybody over the age of 18, you're not going to be able to see their information on My Cigna, even though you're the parent.
Right. With Easy Claims, what it will say on the initial email is it will ask you if you have any spouse, if you have a spouse or dependent that you want to add. So it gives you the opportunity to add it on that initial registration.
Oh, okay, perfect.
So I mentioned this a little bit earlier, but in order to obtain any sort of reimbursement from the difference card, we're going to need to see that explanation of benefits. The explanation of benefits is what you should always pay off of. It will tell you exactly what you're being charged, where it's coming from. So if it's a service that applies to your deductible, your coinsurance, or your copay. So this is an item that's always great for you to refer back to. You want to make sure that your bills that you're receiving from the provider are always matching your explanation of benefits and there's no discrepancies. So the EOB is what the difference card's going to reimburse off of. And it's, again, it should match the provider's bill. Those two numbers should coincide.
Exactly. And this is a good point. This is very important when you're in an HSA plan, because you will receive a lot of EOBs because, again, you don't have that copay functionality on there. So you always want to pay after Cigna has received the claim and it shows your responsibility on the EOB. You may receive a doctor bill prior to getting this EOB and you're thinking you're going to be proactive and pay that doctor bill. Just hold off until you actually have the EOB for any service to make sure that the in-network, particularly if you're going in-network, that in-network deductible has applied, and you just want to make sure that you're paying the correct amount. It's always easier to pay the correct amount than overpay a provider or a facility and then try to get a refund back from them. So when in doubt, always check your EOB.
So on the screen is just a screenshot of our mobile app. On the mobile app, you can do pretty much everything you can do on the website. You can check balances, you can view transaction details, submit claims, and then as well as view any pending claims. If you want to download the Difference Card mobile app, you would just go to the App Store and search DC Mobile or Difference Card Mobile. And then this is just instructions. Again, when it asks you for your employee ID, it's going to be your Social Security number. And your employer ID is going to be just B or C test. You can just put that in. If you put in Motion PT, that will also work. But the really important piece here is your social is used as your employee ID on the app. When you receive a reimbursement from the Difference Card, the standard method is going to be to receive a check in the mail made out to you as the employee or you as the member, and then you would then deposit that check over and use those funds to pay the bill. You can also speed up that reimbursement time and just receive the funds directly deposited into your checking account. So signing up for direct deposit is something that you can do on our website. You would just go to the My Benefit Card button and you'd be redirected to the benefit portal. You would click Claims in the reimbursement preference and then just choose direct deposit in the drop down.
Oh, how'd that change?
That's okay. The last thing about direct deposit that I'll just mention is that you're just going to input the same information that you would use for any sort of online bill pay. So your account number as well as your routing number. And then on the screen, we have a customer service center that's available Monday through Friday, 8 a.m. to 8 p.m. up in White Plains. The number for that customer service center is right underneath your name on the physical Difference Card. You can also live chat with any customer care representatives on our website. Direct deposit, as I just mentioned, makes things a little bit quick and easier, and those funds are generally available once they're processed within 24 to 48 hours. Any manually submitted claims are usually processed within 4 to 6 business days. And this just goes through our information. All of this can be found on our website. And again, that number, that 800 number, is located right underneath your name on the card.
Okay, so I know there was a lot of confusion about cards being received at the beginning of the year. Everybody, particularly if you're in the health savings account plan, lots of different cards around. So we thought this was a great idea to kind of explain exactly what cards you should have and the difference between the cards. So the first one being, we don't have a screenshot here, but going back to your Cigna ID card, if you are in the medical plan, please make sure you have received your Cigna ID card. Now, if you didn't, you can certainly order a new card from Cigna. However, their customer service numbers is on the card, so if you need the customer service number or need a card, just reach out to me and I'll get you a new card. You can always get a temporary card if somebody is new to the plan from the Cigna website, and they have a mobile app. Cigna also has a mobile app, so you can get a copy of your ID card on your mobile phone. So that's the first card. The second card, which is going to go hand in hand with your Cigna, because once you enroll in the Cigna, you're going to be enrolled in the difference card, is the blue difference card, your blue MasterCard. And again, this is going to stay in your back pocket or at your home, because it will only be applied or used when you have a service that's going toward the plan deductible. So this is not a card that you're going to use often. The next set of cards is from Infinisource. So if you were previously in the flexible spending accounts with Infinisource, you probably have the red Benny card. These cards are good because they do have expiration dates on them. So if you have an expiration date that's in the future and you still have a red card, it is still going to work. If you're new to the flexible spending account this year, you may have received the blue card, which is a new format for Infinisource. So either card will work. But just note that they do have expiration dates on them. So at the end of a plan year, don't destroy your card thinking that you're going to get a new card, because you won't. Because of the expiration dates on there, they're going to use the same card. Infinisource does know when the expiration date is coming up, so they will 3 to 4 months prior to that date send you out a new card. So just in a nutshell, Infinisource red or blue card will work for your FSA account. Okay, now the Cigna HSA card. So when you enroll in Cigna for the high deductible health plan HSA account, you're automatically going to be enrolled in the Cigna HSA with HSA Bank. You do not have to open up an account on your own. Cigna is going to send your information over to the bank. They're going to open up your account with your personal information and your demographic information, and you're going to receive a packet in the mail with this green, and it's got the Cigna logo on there with the tree, the green Visa card for your HSA account. This is the HSA account that if you decide to do plan contributions into the HSA, this is the card that is going to be loaded with your plan contributions. Now, the Cigna white card, or I should say the HSA Bank that's white and green, you should not receive this card. A handful of people, what they did was when they did open enrollment and they knew they were taking the HSA plan, they reached out and opened their own HSA plan with HSA Bank. This is an individual account. It does not have the employee contributions going to this account. Some people might have transferred their Optum HSA into this account in error. But what you can do if you have one of these green and white cards, you have this second HSA account, you can call Cigna, you can fill out a form and transfer any funds that you might have transferred in here from Optum into the green Cigna HSA card, if you'd like, and without any fees. Cigna will waive the fees because we did have a handful of people that opened this card up in error. So they're going to close that out and move the money into the green HSA Cigna card, and we'll waive the fees.
Hey, Donna, it's Ben.
Yes.
Real quick, going back to that green Cigna HSA card, one of the implementation errors that we had this year was that Cigna put a lot of us that are enrolled in the higher, the mid plans into the HSA plan inadvertently, which in a lot of instances means that folks in the high and mid plans receive this healthcare debit card as well. So if you are on the high plans and if you are on the mid plans and you do have this green healthcare debit card, there's no funds on it. So so please destroy it. It'll only cause confusion if you decide to use it or try to figure out how to work it with your particular plans.
Correct. Thank you, Ben. Thank you. For those of you that were with Oxford United Healthcare in their HSA plan, you have the white and orange. You may still have the white and orange Optum Bank HSA card. You have a couple of options with this. You can, if there's funds still in that account, you can leave them in there, and you can spend them down for your services under the HSA plan. You can transfer, if you have a balance in there, you can also transfer that into the Cigna account. If you have quite a substantial amount of money in there, you can transfer it into the HSA account. With Cigna, you can leave it in Optum as well. Remember, HSA accounts, you own them. The money doesn't go away. However, you may incur some fees under the Optum account if the balance is less than $500. So to avoid that, you can move everything over to the Cigna HSA account. Okay, so we went through a lot this morning for 7 a.m. But again, this is a learning, is a new experience for everyone involved, actually. So there are going to be questions, there are going to be some bumps, but, we're here to help you as we go through the process together. So, I'm always available. My team over at Broadreach Benefits is always available. Emily is a great resource, and Marcy over at the Difference Card have been wonderful as well. When in doubt, just reach out. Reach out to Ben, reach out to Megan. If it's something a little bit more personal, get my phone number, my email from them, and you can reach out to me directly. And we will walk you through the program. We have really good contacts at Cigna that I lean on, and I have some really good contacts at the Difference Card. So we're going to get you through this. If you have questions, you're confused, you're not sure what you need to do, we're going to walk you through the process. So don't feel like you're out here on an island and you've got all these cards in your hand. You're like, I don't know what to do. Just reach out. We'll walk you through, and I guarantee once you go through the process a few times, it's going to be easier each time you have to go through it. Do we have any questions? We actually are about 10 minutes early.
Anna,
Okay.
This is Teresa. If you don't mind, just real quickly, if this is correct, I'm just looking to help simplify things a bit for the team. The order of registering that may be helpful to folks, if you could confirm. So people should go to mycigna.com and they should create an account either for themselves individually and or now if they have dependents over 18, those should each have accounts created. That's your first step, right? Then you go to the Difference Card because you need that Cigna login information. You need a username, password, and I believe it's critical that you use the same email address. There were notations for that. Register for Difference Card next. Then you could do your easy claims process, should you choose to, which seems like a great idea to me, so you don't have to submit EOBs manually. Also, the direct deposit piece would be next, and that's within the Difference Card platform, if I'm remembering correctly. And that way you don't have to deal with getting checks in the mail and going to the bank. And if you do register for that, they'll do an automatic deposit withdrawal into the account that you've chosen. So for example, if you've chosen your checking account, they will do, 2 small deposits and 1 withdrawal to cancel those out, to confirm that they have the account information correct. And you will verify those. You'll have to go back into the website to verify those after you see them process in your account. So I'm just trying to summarize for the team an order of events to kind of simplify registration here. Does that all sound correct to you?
It does. You definitely want to start with mycigna.com. That's going to be your starting point for the Cigna website. and then your user information from there is going to be applied to that easy claim.
Right, and difference card as well, so that they connect. I think
Right.
you need the Cigna
Yep.
login information on difference card so they connect.
Yep, you need it for easy claims. That's correct.
Right.
Right.
Thank you.
So is that you, Ben?
No, it's not.
Oh, okay, because I do see, so, again, if you have dependents that are over the age of 18, and Emily, you can confirm this for me. I know with the carrier accounts, if you have dependents over the age of 18, they have to register themselves onto mycigna.com. You're not going to be able to see their claim information if you're logged in as yourself, even though you're the parent. If they are over 18, they have to register out on mycigna.com themselves. However, Emily, if the member signs up for the easy claims, do all dependents have to sign up for easy claims, or does that member have all their dependents under that account? So in other words, your dependents don't have to sign up for easy claims.
So your dependents aren't going to get an email specifically. You're going to get the email because you're the member, and in that email it's going to ask if you'd like to sign up your spouse and dependents. Donna, as you mentioned earlier, because anyone in Cigna's eyes who's over the age of 18, they're an adult, so they are not going to show up, the EOBs for them are not going to show up on your portal as a member. So you would want to enroll them. They don't have to do it themselves. They don't get their own link. It's all within your link. All you would need to do is input their username and password.
And if you use that link already and did not do that in advance because you did not know that they each needed separate, can you reuse the link?
Sure, I think you can, or you can just call our customer care center. They're great. They know everything about easy claims, so they'll be able to help you sign up your spouse and dependents. It's a great question.
Perfect. Great. Do we have any other questions? We've got about 3 minutes. We are going to have another webinar this evening at 7. And we did record this, and we'll record tonight's as well. So this, I will send this over to Ben, and we'll get this posted out to the employee website. But, hopefully everybody did find this informative. Remember, the difference card is here to help you with your out-of-pocket costs. When you do call Cigna, you, as we mentioned, you are going to be told that you have this high deductible, this $5,000 deductible. We certainly don't want people to, panic when they hear that and be like, oh, my goodness, because it does have that. But, Motion PT has done a great thing with partnering with the difference card to reimburse them, you as the employee for these out-of-pocket services. So, just any questions, feel free to reach out. But I think it's overall it's a really, really very good plan. Just a couple bumps we have to get through, but I think it'll work out well for everybody.
All right, I want to thank you both, Emily and Donna, for shepherding us through this session. Really informative, and I really appreciate it, and I hope the team did as well. And like Donna said, feel free to reach out to me, to Megan, or to any one of us on the line, and we'll certainly get you through those questions that you may have.
Perfect. All right. Well, thank you, everybody.
Thank you all.
Thank
Have a
you.
great day.
Enjoy the rest of your day. Thank you, Emily.